Let's talk about artificial hair implants, also known as synthetic hair. In the 1970s, a new technique using artificial hair was introduced for hair restoration. Frequent, severe adverse events were seen. As a result, the U.S. Food and Drug Administration banned implantation with industrial fibers, such as polyester, mode acrylic, and polyacrylic fibers in 1983. And this is similar to thread lifting and how that was banned in 2009 for similar reasons. There is a clarification on the ban from the FDA in 2020, and it reads like this. The FDA found there was no public health benefit to this device. This device presented a substantial deception to patients or users about the benefits of the device. The prosthetic hair fibers did not stimulate hair growth nor conceal baldness, but could actually cause serious infections, illness, and injuries from their implantation. We believe that the labeling and advertising materials directly or implied misrepresented the device as safe, effective, and causing little or no discomfort, among other misleading claims. As of December 2021, the International Society of Hair Restoration Surgery aligns with the US FDA position on this matter. However, the Council Concerning Medical Devices in the European Union recognized the artificial hair implant technique as a medical act in 1996. The product that heralded the return of this procedure in Europe was Biofibre, and this was made out of Italy, and these were biocompatible fibers. And these are being used in many countries, just not in the United States. So what is a biocompatible fiber? Biocompatible fiber is a polyamide fiber. They are available in 13 colors with different lengths, 15, 30, or 45 centimeters, and in various shapes, such as straight, wavy, curly, to satisfy different patient requests. They're also available in a new high-density version called MHD, which allows for each implant to have 3 hairs implanted as the final result. I want to take a second to thank the sponsor of today's video. Established Titles is a fun and novel way to preserve the natural woodlands of Scotland while helping global reforestation efforts. It is a project based on a historic Scottish custom where landowners are referred to as lords and ladies in English. Title Packs gives you at least 1 square foot of dedicated land with a unique plot number on a private estate in Eddleston, Scotland, and an official certificate with a crest. You know, being a doctor wasn't enough of a title, so I decided to also become a lord. Established Titles plant a tree with every order and work with global charities. 1 tree planted and trees for the future to support global reforestation efforts. You can officially include the title of Lord or Lady on your credit card, plane ticket, dating profiles, and it also makes a great last-minute gift. The first 200 people purchasing a title pack will effectively be my neighbors. Their plot will be next to my plot within like a few minutes walking distance. So if you want to support the channel and become a lord or a lady, we can build our own little kingdom. Right now, Established Titles is running a massive Black Friday sale. Plus, if you use the code GARY10, you get an additional 10% off. Go to establishedtitles.com/Gary10 to get your gifts now and help support the channel. The implant technique is a surgical technique performed by a manual or automatic implanter under local anesthesia. A small hooking needle places the root of the fiber under the scalp at the galea level where the root can be held by fibrous tissue. The root is a reversible knot that ensures correct anchorage of the implant and allows total fiber extraction if needed. With the appropriate traction, each fiber can be pulled out entirely with no residue in the scalp in case of non-treatable side effects or for unsatisfactory results. So who is not a candidate for this type of procedure? Well, patients with a risk of infection, autoimmune diseases, or chronic scalp disease, including non-stabilized alopecia areata. Also, the company lists the following conditions as being a contraindication to the biocompatible fibers. These include diabetes mellitus, hepatitis A, B, C, autoimmune diseases, chronic scalp diseases, severe psychosis, non-stabilized alopecia areata, stigmata and a lack of personal hygiene or employment in dusty or dirty environments. Extensive blood testing and a urine analysis is recommended to rule out some of these underlying conditions. So this is how it's done in clinics who offer this type of procedure. All patients initially receive the implant with only a small amount of fibers to secure tolerance. So usually about 100 fibers are placed to make sure that the person isn't allergic to the fibers, that they're not going to immediately reject them. If tolerated, larger sessions can be added after a month. An average implant of 600 to 1,000 fibers per session is often appropriate, performed at intervals of 1 month. An average amount of 2,300 fibers is implanted per patient in total, varying depending on the size of the treated area. Spontaneous fiber loss is 10% to 20% per year, as it is gradually rejected by the body. So providers who offer this treatment recommend the following to stay safe. A correct hair implant procedure requires a combination of safe fibers, suitable implant instruments, trained doctors, careful patient selection, and proper aftercare follow-up. As far as complications go, the literature reports a 6% to 13% rate of allergic, inflammatory, or infectious complications, in which approximately 2% were not solved and required fiber extraction. Infections are mainly caused by Staph aureus. Severe adverse reactions have been reported, including osteomyelitis and infective endocarditis. Essentially, once an infection takes hold, it can start to spread, and on the scalp, the bone is nearby, and also, once the infection gets into the bloodstream, it can travel, and that's how you can get this type of endocarditis infection. Here you see an example of a 27-year-old woman who was known to have congenital alopecia, had constant pain and itching of the scalp after implantation of 9,000 biocompatible fibers. The examination found multiple tender erythematous nodules with pus. You can see here the overview of the back of the scalp as well as a close-up of the same area. The biopsy showed non-necrotizing granulomatous foreign body reaction. So essentially the body was mounting a robust response to what it saw as foreign. In her case, steroids were used to improve her situation because she apparently declined removal of these fibers, and eventually things got better according to this study. Here I found an example of a before and after of someone who had these biocompatible fibers. In the first picture, you can see a patient with androgenic alopecia who has significant thinning in the frontal, mid-scalp, and likely crown. Here you can see the final result with 5 implant sessions for a total of 4,000 biofibers. Overall, I would say that there is, at least in this image, some degree of naturalness, but the hairline could of course look more natural. And then also keep in mind that these fibers, even though you can cut them down, I mean, they'll never grow any taller. So most of the time you're somewhat limited with how you can style the hair while you have these fibers in place. Also, you'll need to go back essentially almost yearly to continue to get additional fibers placed because your body's going to be rejecting them, and you have to worry about this potential for infection and inflammation that can come about at any point. Here you see some graphs that list out the percentage of patients who have gotten rejection of the fiber loss after a year, and in most of the patients there's no more than 10% loss, though when I watched some videos by physicians who offer this type of procedure in other countries, they reported a higher percentage than what I'm seeing from this paper. Patient satisfaction rate was quite high, but you do have to wonder about, introducing bias when you do studies like this. And also the tolerability and side effects that at least this study reported were quite low as far as side effects. And again, it's not clear if it's being underreported or if it's really that patients are that satisfied with these results. Overall, the biocompatible fibers appear to be safer than what they were in the 70s and 80s, with what seems to be high patient satisfaction, but still with plenty of risk. Results can look natural, but require regular maintenance yearly at a minimum. Given the risks of infection, which in general are fairly rare on the scalp but seem to occur at a higher rate than I think is acceptable from these fibers, I would avoid this procedure. I would seek alternatives to scalp hair transplants, such as body hair transplant or hair systems that work quite well. It should be stated that biocompatible fillers that we use these days and dissolvable threads, along with many other non-invasive aesthetic devices, also offer plenty of inherent risks and challenges that must be weighed against the aesthetic benefits that they sometimes offer. If you're interested in learning about a safer way to restore your hair, check out these videos.